Welcome to our lesson on understanding health insurance cards. Health insurance cards are proof of a patient's insurance policy and are critical for verifying coverage, ensuring accurate billing, and facilitating smooth check-ins. Typically, these cards include the patient's name, member ID, date of birth, insurance name, group number, and payer ID. Let's look at a sample Anthem insurance card. Notice the member ID prominently displayed at the top. This number uniquely identifies the patient within the insurance company's system. Below that, you can see the group number, which often represents an employer or a network. Notice the bottom right corner, where the suitcase icon is located. This icon indicates whether the plan includes out-of-state coverage, also known as a blue card. If this icon is blank, additional verification might be required to confirm the patient's coverage. Also note this area at the bottom, which specifies the type of Anthem plan. The type of Anthem plan helps determine network eligibility. For example, if the plan type isn't marked as PPO, further investigation may be needed to ensure your clinic participates in the network. Next, let's look at a sample Cigna card. Notice the phrase "No PCP required" printed on the card. This means the plan does not require a primary care provider referral for specialist visits. Now, look at the health plan number displayed toward the center of the card. Be careful here. This number is different from the group number and should not be entered as such in the system. Below it, you'll find specialist copay amounts, which can vary significantly from primary care copays. Be sure to check and document these details accurately. Now let's look at a traditional red, white, and blue Medicare card. Notice the Medicare Beneficiary Identifier, also known as MBI, here in the center. This is a unique number for each patient. The start dates for Part A and Part B coverage are listed below. If Part B is missing, it likely means the patient has other commercial insurance for office visits, so you would need to be sure to ask the patient about additional or secondary insurance coverage. Now for comparison, let's look at a Medicare Advantage card. Notice the RX indicator we see here. This signifies prescription coverage under the plan. Directly below, you'll see the phrase "referral required." This indicates that the patient's PCP must provide an authorization for specialist visits. As discussed elsewhere in the course, missing this step could mean the clinic won't be reimbursed should appropriate referral not be received prior to the visit. Now, let's take a look at the railroad type of Medicare cards. Depending on where your practice is located, you may not see these very often. But understanding the difference is crucial since their claims are processed differently than those for traditional Medicare. At first glance, this card looks nearly identical to a traditional Medicare card. However, there is a key difference. At the bottom of the card, you'll notice a small but important indicator that this is a railroad Medicare card, and it's this which signifies that the patient's claims are processed through railroad Medicare, which follows the same Medicare policies but operates independently. Noticing this subtle distinction is critical. If a patient presents a railroad Medicare card, the claims must be sent to the appropriate processing center, not the standard Medicare system. Additionally, credentialing requirements for railroad Medicare are slightly different. While providers are typically credentialed with traditional Medicare first, they must also complete a separate credentialing process with railroad Medicare. This usually occurs the first time a claim is submitted for a railroad Medicare patient. Now let's look at a sample card from a cost-sharing program like MediShare. These cards often resemble insurance cards, but are not traditional insurance plans. Look for disclaimers such as "This is not insurance." In most cases, your clinic may need to treat these patients as self-pay unless you have an agreement with the cost-sharing program. Here are some best practices to follow. Verify details on screen. Always cross-check the card's physical information with what is entered in the computer. Look at both the front and back of the card for essential details, such as claims addresses or customer service numbers. Ask questions. If you're uncertain about a card's information or its validity, consult your billing or office manager. For example, if a group number or payer ID seems unfamiliar, double-check with the appropriate supervisor. Document thoroughly. Scan both sides of every card during check-in. This helps prevent claim denials and ensures your clinic has all necessary information for follow-ups. Educate patients. If a patient presents multiple cards, help them identify which card is active and clarify their coverage details. For instance, if a patient has both a Medicare Advantage card and a red, white, and blue Medicare card, only the Medicare Advantage plan is valid unless it has been terminated. Stay updated. Keep track of annual changes such as copays, group numbers, or new plan types. Insurance cards play an integral role in your duties at the front desk. By understanding their details and staying vigilant, you'll ensure accurate billing, minimize claim denials, and create a smooth experience for your patients. That concludes our lesson on understanding health insurance cards. You may now move on to the next topic.